So now, how can we actually diagnose diabetes? There's a thing called fasting blood sugar. Fasting blood sugar is measured when the person has not eaten anything for a fixed interval of time. When you measure blood sugar level within this interval of time, then this is called fasting blood sugar. And for a normal person who is not diabetic, for that person, this value is less than 100 milligram per deciliter. When we talk about a person who has eaten something and we have tried to figure out how much is the blood sugar level within 2 hours, then this is called postprandial blood sugar. Means uh, after eating something, what is the blood sugar value? So for a normal person, this has to be less than 140 milligram per deciliter. And if someone is in pre-diabetic state means he is about to get diabetes. He's not diabetic yet, but he is about to get diabetes. Then his value would be from 100 to 125. This value of 100 to 125 is for fasting blood sugar level. What I know, it's fasting blood sugar and pre-diabetic state. You are getting confused in this. So let me make you understand again that there are three categories of people. One who is absolutely normal, second who is in pre-diabetic stage, third who is diabetic, like he is suffering from diabetes. Pre-diabetic stage is not someone who is in diabetes, he is about to get diabetes, so you can save him from getting diabetes, right? So for a pre-diabetic person, random blood sugar, what is random blood sugar? Sorry, for a pre-diabetic person, what is fasting blood sugar level, right? Fasting blood sugar, it's same for the normal people and the pre-diabetic people. Means the person who is in pre-diabetic stage has not eaten something for a fixed interval of time, right? So and that value is around 6 to 8 hours. So if a person has eaten nothing for 6 to 8 hours, and for that person we are trying to figure out what is the blood sugar level, then that value should be 100 to 125 for a pre-diabetic person. The fasting blood sugar level is 100 to 125. I would try to explain it again because it's getting really the entire these few terms are quite confusing for newbies. So I'll I'll try to explain it again. That for a pre-diabetic person, fasting blood sugar level is 100 to 125. For a pre-diabetic person, postprandial blood sugar value is from 140 to 199, right? So anybody who is in pre-diabetic stage, his value is from 140 to 199 when it comes to postprandial blood sugar level, right? For diabetic person, a person who is suffering from diabetes, his value is more than 125 if we are talking about the fasting blood sugar. The fasting blood sugar level in a diabetic person is more than 125 milligram per deciliter. If we talk about postprandial blood sugar level in a diabetic person, it is more than 200, right? There is one more way to decide that the person is diabetic or not, or the person is pre-diabetic or not, or the person is diabetic or not. So this is called HbA1c. This HbA1c is considered a better criteria to diagnose a diabetic person than uh, the you don't have to check multiple times, as in the earlier case we were trying to see that what is the fasting blood sugar, what is the postprandial blood sugar, and we were trying to see the blood sugar level at various occasions. But when we talk about HbA1c, we just have to do one test, and that test will entirely tell you that okay, this person is diabetic or not, or this person is pre-diabetic, or he is totally a normal person. So HbA1c, if the value of HbA1c is somewhat less than 5.6, then this means that the person is absolutely normal. You don't have to worry about diabetes, right? When the person's HbA1c value is somewhere between 5.6 to 6.5, he is on the way to get diabetes. Means he is in the stage of pre-diabetes. So a person whose value is somewhere between 5.6 to 6.5, he is in the stage of pre-diabetes. He's not diabetic yet, mind my words. He's not diabetic yet. He is on the way to get diabetes. And if a person's value is more than 6.5 and somewhere around 6.6 and 7 and all, he is a diabetic person. And this is where you need to take